Before we jump into the episode, I just want to provide a quick bio to Dr. O. Dr. Norum is a distinguished physician, advocate, public speaker, and leader in the field of public health and equity. She's a family doctor and public health and preventative medicine specialist and assistant professor at the University of Toronto in Canada. Born in Montreal to parents of Nigerian and Trinidadian backgrounds, she learned at an early age the impact of social injustice and the power of community action. With a deep commitment to social justice and health equity, Dr. Norum has dedicated her career to addressing health disparities and improving health outcomes for marginalized communities, with a particular focus on Black populations. Her expertise lies in the intersection of race and health, and she has been instrumental in advancing equitable healthcare practices and medical education policies. Her platform, Healthcaring Differently, will be running a webinar for parents of future doctors. Is your child dreaming of med school, or are you a student navigating the path yourself? They will be hosting a webinar on this Thursday, September 18th, 2025, 7 p.m. to 8:30 p.m. Eastern Standard Time, and I have a link in the description box to register for the webinar. So make sure you sign up. Now, on to the episode. So, Dr. O, could you please provide the audience with the background as to why you created the Healthcare Differently platform? What was the gap you saw concerning healthcare education and mentorship in the field?
Sure, yeah. Healthcaring differently is what I'm kind of calling a digital mentorship outreach platform. So, I'm a physician. I want people to know that I'm here and I'm not, part of, I guess, the most represented group that it's usually white Canadian or white Canadian male when you think of a doctor. So I'm not the majority representation in medicine, but I'm also not alone. There's so much diversity in healthcare and in medicine, and I want young folks to like see that not only we exist, but like me and my colleagues and a lot of the young folks who are coming up in healthcare who are students are doing really cool stuff with regards to outreach, with regards to changing the game, making sure that we bring our authentic selves and our perspectives to be able to change healthcare and ideally improve it. So we're
Mhm.
different, but we're also healthcaring differently. And for me, this is important because sure you have my bio, but at the end of the day, for me as a person on this land, as a Black person on this land, my parents came here via immigration. So my mom was Trinidadian, dad Nigerian, born and raised in Montreal. Right, I live in Toronto or Toronto now, and for me, I had working class parents and they weren't professionals. One in five medical students is the child of a physician, right?
Ah,
Not to
mhm,
mention the other folks who might, their parents were professionals or whatever. So I came through mentorship. So I believe really deeply in mentorship. And I believe in health advocacy. So the work I do focuses on Black health, it focuses on racism, it focuses on how discrimination impacts our health and how justice and change in our society can actually impact your health and make it better. So
right.
I walk my talk. My lived experience completely permeates how I provide care to patients, how I do that in different settings. So, I work in a number of different settings and making sure that other students feel empowered to explore healthcare, even if they don't want to be a doctor or nurse or be in healthcare at all.
Mhm,
Being young folks should be able to explore it, know about the cool things that are going on, and if they are interested, feel like they are empowered to do so.
mhm.
And Hope Caring Differently also provides a newsletter where there's information about opportunities for mentorship and pathway programs, so people can get that mentorship. So that's it. It's a bit of like what the platform is, but it's also very near and dear to my heart and my pathway into my profession.
Oh, I love the title of Healthcaring Differently. I studied engineering. I think it's similar. You don't see people represented who look like me in engineering, and it can be very difficult to even want to take the first step to do something when there's people. that don't look like you, you can really limit your thoughts. Like, am I even capable of doing something like this? So having that mentorship, having people in your corner who can really root you on as you go on your journey is just so important. So I love that you've created this platform, and we'll definitely leave a link to the description along with your bio to the newsletter as well, so people can sign up to this really important initiative. And on to the next question. Can you speak to the importance of diverse representation in the healthcare field? We kind of touched on this a bit, but just really getting your thoughts on this would be great.
Yeah, yeah. So I'd love to talk about that because I mean, having diversity and diverse voices in any field is important because people bring their experiences, right?
Mhm,
But I think it's particularly powerful in healthcare. I tend to talk about medicine a lot because I'm a physician, right? But a lot of this applies to all of the fields in healthcare. And also because Black and a number of different racialized groups like Filipino, West Indian, and also Indigenous people are underrepresented in medicine. So I tend to focus on that. But when you think about the care that people need, right? And the things that make people sick, I think when you come from an underrepresented group, you bring something really crucial to healthcare and the table. So let's talk about, we'll start with care, the care that people receive, right? The care that people receive when somebody who is from a different culture or speaks a different language, or is racialized, and I give the example of Black, comes to the emergency department in a particular hospital. Oftentimes they might experience biases, right? Like
mhm,
assumptions made about them. We see that in sickle cell, a genetic condition that tends to be people of West African and Central African descent. And so not being believed, waiting longer times in emergency rooms, right? So we saw a report on that in Manitoba, and we've seen it certainly in the United States, right? So all of these biases being there. When somebody comes from a group where you've experienced the same kind of exclusion or problems like that, there's a certain sensitivity to it,
mhm,
oftentimes, where you might look at somebody and say, wait a minute, I remember this being talked about in my community, even if it's from a different community. Are we triaging that person appropriately? Are we making assumptions, right?
mhm,
And so making sure that the care is compassionate and empathetic. And of course, there are studies to show that when you do have things like race concordance, so where people are from a marginalized group, so a racialized group, and they're of the same race, there tends to be a little bit more connection compared to
mhm,
if they are with a white provider, like the dominant group. And so that sense of humanity, that sense of understanding, or just cultural nuances, understanding those things. Again, even if you come from a different culture, sometimes it's just the cultural dexterity that you have because you weren't part of the dominant group. You might interact with a patient differently. And
mhm,
and that kind of knowledge can spread to the team because it shouldn't be up to the doctor or the nurse who is racialized or speaks a different language or culture to carry that all on their own. But there's the beauty of the team coming to a better understanding. Yeah.
mhm,
So that's there. It's even more beautiful if people receive the training when they were coming up so that it helps to reinforce it, right? So that person isn't alone. So the quality of care can improve when you have that kind of diversity there. But the other piece is the things that make people sick. So there's this term called social determinants of health, and that's like based on like level of education or how you're treated by society. So, for instance, for Black children, how you're treated in the classroom and the stress of being a
mhm,
student while Black, and then the stress of trying to get a housing and a job and doing all of these things while Black, all those barriers that people face. And
right.
even if there is no barrier, there's a stress of anticipating a barrier.
Mhm,
So if you have a job interview, even if racism doesn't come into play, because it's part of our society, the night before, if you're from a Black or racialized group or you're Indigenous, odds are you're stressing yourself out the night before,
mhm,
trying to think about all of the different things you can do to not collide with a stereotype that's going to
mhm,
lead to you having a worse outcome. So that's just an anticipatory stress, right? So where the social determinants of health, all these different factors make people more likely to be in the hospital. So we see people who are of lower income, lower education, experiencing racism or other forms of societal stress, that's actually a big bulk of who will be seen in a hospital, right?
Right.
So these are the everyday things in our lives that make us sick, right? By the time you get to the hospital, usually the hospital didn't make you sick. Life, right? The
Mm-hmm.
things that you've experienced in your life. Now, when you have a provider who has had a similar journey, right? Because they're Black or Indigenous or lower income or something, they understand that they're going to approach that patient who has the addiction issue or the obesity issue or what, whatever issue it might be in a slightly different way
Mm-hmm.
because they've experienced some of the social determinants of health themselves compared to somebody who's coming from like a fully privileged background where they haven't experienced being lower income or racism or sexism or heterosexism or any of the isms, right? If you happen to be
Mm-hmm.
part of the dominant group, it's a little bit harder to understand that journey.
Mm-hmm.
And so these are the things that can help with empathy and better patient outcomes when you have groups that have been historically excluded being encouraged to enter the field, right? Because that's been missing in
Mm-hmm.
healthcare. And so when you have that team, and again, I'm not talking about that one person, although there is evidence that having that one person actually makes a huge difference. So there's studies in the United States saying when you have more Black physicians, the whole population actually does better, and certainly Black patients do better. There's that piece, but also the team will function better.
Mm-hmm.
Um, and so uh, I feel like it's crucially important to
Mm-hmm.
have diversity in a field like medicine or in healthcare where we're dealing with people's lives. And it's not just going to be about genetics and prescriptions. It's really about people's lived experiences, how they're embodying their conditions, and how they can be, and all of the different solutions that require creativity so that they can be better. We need to all be at the table and we need to all be serving from diverse backgrounds.
Yeah, absolutely agree for sure. I had a previous interview with someone who's a great patient advocate for senior care, and he had mentioned even a lot of medical conditions can lead to loss of appetite, and he had mentioned his father was struggling with some of the food that was being recommended to him because it's not something that he grew up with culturally.
Yes.
So even that aspect of the food and how that can affect you. And then I also have a cousin who works as a clinician and in the hospital. And it was really funny because one patient came in and the nurses were trying to figure out, what language is she speaking? Because this is Toronto, we're very diverse here, and they were going through their language app trying to understand like what language is this? And my cousin came and she was able to recognize that she was speaking patois, which is a Jamaican dialect.
Yeah, yeah.
So, I think it really is a plus for when it comes to a diverse healthcare team, because as you're saying, it really helps the whole team be strengthened, and I think it helps improve patient outcomes at the end of the day. Um, so yeah, and then just picking up back what you said when you're talking about like some articles in the U.S. have shown that racial concordance, especially when it comes to Black patients who have a Black physician, can really improve outcomes. There's a paper that again we'll leave in the description box called "Increasing Representation of Black Primary Care Physicians: A Critical Strategy to Advance Racial Health Equity," by Dr. Peak, and it talks exactly what you're saying here, that having a Black physician can really help improve patient outcomes. So my question around this is this something that you've noticed amongst your colleagues from diverse backgrounds, specifically from Black and Indigenous populations, that they tend to be involved in local community organizations, creating platforms like yours, Healthcare Differently, and what effects do you think this might have on the social determinants of health for Black patients?
Yeah, so you know what? There's a few parts to that, but it's really interesting. So that study showed that like on a one-to-one, you could see that, patient the race concordance when it was a Black patient and Black doctor. And then as you said, at a population level, it made a difference. And it showed that Black and racialized doctors were more likely to be involved in community work. So then just helping a population, like, boards of education or what have you. So that's kind of the premise around health caring differently, because yes, I do think not all of us who are different, but a critical mass of us who are different approach healthcare differently because of the communities that we have been part of or the communities that we decide to serve. It might not be that somebody who is Black might be specifically working with Black communities. They might be working with South Asian or Indigenous, but their lived experience, plays a part, but also looking for creative solutions because we come from different communities where we saw people do things, So for instance, I'm like I said, I'm half Nigerian, half Trini, but there's ways that people would come together to advise each other in that idea of the collective, right? So bringing that into how we might do diabetes education, for instance, at Taibu Community Health Center, it's done as a group and a community. You go to the grocery store together, you cook in the community kitchen together, and try to kind of make a heart healthy version of certain dishes, right? So bringing those ideas and principles actually brings innovative approaches, but also, yes, for better or for worse, a lot of us do extra work, extra unpaid work, and I have done a lot of that. And healthcaring differently comes out of that. I took a bit of time off after the pandemic, and then people were having me go to high schools and call, different community centers to speak about healthcare. And then I was like, oh, wow, there's all these opportunities across the country. Why don't I go digital and let people know about all of these different opportunities? And then, we can post in the newsletter about what's going on locally, that people can go to something IRL, like in real life. It's not all digital, but people can find those things. So that comes from my volunteer work. So yes, a lot of us do that. And we know, at least for Canada, as far as statistics, like for instance, if you're from a rural community, and like that was part of one of the newer medical schools in Canada. Now there's a few newer ones, but for the last 10 years, at least one of the new ones, the Northern Ontario School of Medicine, it's based in the north because of the research showing that if somebody is from a rural community and they go to medical school, they're more likely to go back to that community. They're more likely to serve in a broad way beyond
Okay.
just, the typical clinician, but doing things in a really deep way because they feel a connection. And
Okay.
so yeah, I don't know that it is a fact the way they were able to trace it in that paper that
Mhm.
Black folks and racialized folks who were in medicine did more community work. But I could say, based on what I've seen with my colleagues, that is why I created health caring differently because I think we do it differently. And part of that is non-paid or community work. And yeah, so my observations match with what you're saying, but I don't know statistically if
Mhm.
that's, the case. Yeah.
Okay, that's super interesting. And then I'm wondering your thoughts again on like community healthcare centers and um, kind of what you kind of see their role in the whole model of healthcare in Canada. And because I think there's a lot of community involvement when it comes to the community health centers. There's a lot of opportunity to look at, not just healthcare, but social determinants of health, such as um, food insecurity or housing insecurity and things like that. So I'm just wondering your thoughts around community health centers.
Yeah. So I feel like I can't even answer in an objective manner because I love community health centers. I've always like,
Mhm,
even in Quebec, they have like the C3S or CLSC is what it's called, but it's a similar model. And that's where I used to do like refugee health outreach as a medical student when I was at McGill. And then when I came here, absolutely, I gravitated towards community health centers like Women's Health and Women's Hands, which focuses on racialized women, Taibu
mhm,
Community Health Center, which focuses on Black and Indigenous and Francophone communities. Even up north, Long Lac CHC, where I was working north of Thunder Bay in a small community,
mhm,
French community out there. So I love that model because it's holistic. So for people who don't know, it's really a center that's built based on the needs of the community. Every CHC is quite different.
mhm,
Um, and you have, physicians and nurse practitioners and dietitians and social workers and a number of services like, mental health and other things and community programs, like you said, addressing the social determinants of health, like poverty, education, and things like that, that are all in-house.
mhm,
So, I mean, I'm just a huge fan of that model because I saw people like get better and do well. Part
mhm,
of my favorite, the favorite part of my work for me when I worked at Taibu Community Health Center. So, like I
Mhm.
said, it's a center out in Scarborough with a mandate for Black, Indigenous, and French. But at that time, their mandate was strictly Black communities and the
Mhm.
racialized local community. But, my favorite thing to do was deprescribe, right? Like we live in a time of chronic diseases, but if people
Mhm.
have the right, like, foods and the right information and the supports,
Mhm.
then you can actually reverse conditions like diabetes and high blood pressure that you see in high prevalence in Black and South Asian communities. And the
Mhm.
biggest beauty of that was that it wasn't because people went jogging and ate carrots and sandwiches. Um, it was actually tapping into ancestral wisdom of what our diets used
Mhm.
to be. And so,
Mhm.
yes, if you're having rice and beans and some okra,
Some
um,
yams.
some yams, and you skip the fried chicken, right? Which is, colonial invention. Um,
Mhm.
then people were starting to lose weight. Their
Mhm.
blood sugars were coming down, and after a while, I didn't need to prescribe insulin or metformin. When they had social supports, when they knew, the heart healthy way to take, a particular recipe, or that they could still have plantain, but or plantain, depending on where you're from, in certain proportions, and be healthy and that type of thing, then their numbers would start to come down. And a lot of people don't even want to take that many medications, even culturally or
Mhm.
beliefs wise. But there's a certain amount of work and guidance you need with that. What was cool for me in a community health center setting was one, I wasn't alone. It wasn't like your usual doctor where you just go to the clinic or the walk-in and they prescribe you something. Like I would talk to the patient and I played my role when I had to, particularly some people do need prescriptions. I'm not saying everybody can just come off of everything. Then I
Mhm.
walk them down the hall and they can spend time with the dietitian who can tell them in their culture because they had that cultural dexterity. That's the word that I like to
Mhm.
use. It might not
Mhm.
be your own culture, but you've learned about different cultures, right? So that
Mhm.
cultural dexterity to help people manage their diabetes in a way that was culturally affirming. And then on, whatever day, Wednesday, then everybody would come to the community kitchen and cook together because
Okay.
being connected also helps your health, right?
Mhm.
As we saw during the pandemic, it was the reverse, right? Most people
Right.
health tanked because of social isolation. So where, Taibu would create that connection and let people know how they could do it in an affordable way. A lot of our
Mhm.
cultural and traditional foods, when you make them heart healthy, usually the way they used to be, like originally,
Mhm.
without the high fat, high salt, high meat kind of things, um, then it's actually not terribly expensive.
Wow.
So yeah, I saw people come off of their diabetes and blood pressure medications and reversed chronic disease diagnoses. And I don't think that would have been possible in a regular clinic. I think
Mm.
only a community health center where you have a whole team.
Mhm.
That's why it's called health caring differently. It's not just the role of the doctor. There were
Mhm.
so many things in cancer screening, so many things where we actually said, you know what, the doctors are not good at providing this advice. The nurses are better, and the physician assistant is better, and the dietitian is better. Let them do their thing, and the
Mhm.
community is better. So,
Right. Right.
yes, that's my rant for community health centers. Speaking of like, you're on YouTube. So I have a YouTube series through Health Caring Differently
Mhm.
called Patient Empowerment. And I talk a lot
Oh.
about community health centers as an option for people who are, marginalized or part of equity deserving groups or minorities, as people would say. But I talk a lot about how to navigate healthcare because it can be daunting
Yes,
in this
absolutely.
environment. So yeah, so you can check that out too. But I do go on and on about community health centers.
No, that's great. I'm also biased because I'm on the board for a community health center where I live in Ottawa, and I see the impact of community health centers. So it's great to hear that it's across Canada as well too. That's awesome.
Mhm.
So Dr. O, this has been such an insightful and rich conversation. But before we wrap up, I wanted to ask you, what's like one of the most surprising things that you've learned since starting this digital mentorship resource? It doesn't have to be healthcare related. It could be technical related. It could be anything you found.
Yeah, no. So I've learned a lot of surprising things, but I'll keep it short and concise. So with health caring differently, the principle that I initially based it on was that I would interview my colleagues live on Instagram Live so that
Oh,
students could
okay.
just participate and ask questions.
Mhm.
So we did this for a full year. Like I launched it last year. We did it for a full year. We decided to do focus groups. And the most surprising thing was students and parents were like, we don't want Instagram lives. Like
Oh,
that
really?
is not the way
Mm,
that we want to access health information. And
mm,
I mean, you have the answer to what they wanted. People are mainly said they wanted YouTube so that they could search
mm.
for the topics and search for the
Okay.
information.
Mhm,
And with that, we also realized that parents felt like they were being not excluded, but there wasn't a lot for parents. You know, parents like my parents had been like people who are not in medicine or healthcare, but
mhm,
want to support their child through the process of particularly applying for medicine, but understanding and navigating, applications and things like that. So as a result, one, we are changing now. So I mentioned I had like YouTube videos. So I have a YouTube video for parents of future doctors. So we're
mhm,
transitioning to YouTube.
mhm,
And on Tuesday, September 18th, 2025, at 7 p.m. Eastern, we are having a live webinar where students who are interested in medicine and their parents, so we're
mm,
particularly aiming it at parents to join in as well, can hear from admissions leaders across the country who are doing, medical admissions and focusing on underrepresented groups. So I'll
mm.
be hosting that, and so it's totally free of charge, totally free for parents and students, particularly from underrepresented groups, to hear about what you need to get into medicine specifically, going from high school to university, like the whole thing.
Mhm.
And so that was like, we started off with Instagram Lives, but the most surprising thing was that's not actually what, people wanted. And that's okay. That's you have to start
Mhm.
from somewhere. We
Yes, exactly.
ask the people, hear the people, and and then follow through. So that's what we're doing. We're I'm gonna do more YouTube clips and we're having live webinars where parents are involved and can ask the questions.
It's an amazing initiative, like, and a great just resource for people just to understand, like, even where to start. Because you're saying if you don't have this background, I'm still shocked by the 1 in 5, people who have a parent who was in medicine, and that's kind of, much easier for them to kind of navigate the system. So it's just great that you're having this initiative so people can get that education and can get that opportunity. So I'll definitely, we have so many links to share in the description. I'll definitely make sure to share all that information as well too. But thank you
Yeah.
so much, Doctor.
Thank you. I mean, it's healthcaringdifferently.com. Healthcaring Differently is our handle for everything. But yes, please check it. Please check it out however you can. So whether it's clicking the links that I send to you or however. But yeah, thank you for having me, and thank you for the work that you are doing, Alana. This is
Okay,
fantastic.
thank you very much.